so that when the person closes, that bone presses on the tender tissue back here. When they open, they can open a little bit without any noise. As they open wider, they hit the disc, and then as they continue opening, they click onto the disc.
Oh.
If the disc would stay in place at that point, that would be wonderful. If we could quickly squirt some super glue in and make it stick, that'd be fantastic, but there's no way to do that.
No, unfortunately not.
So when the person closes, typically in cases like that, the disc goes back out of place again. Then the next time they open, there's another click. That's the most common kind of click. And again, we can see that in Dr. Westison's video if we go to the second one. And here you can see the disc sitting in front of the condyle. As the person opens, you see the condyle turn and go forward. It pushes on the disc, and then suddenly the disc pops into place again. That's, again, the most common kind of TMJ clicking there is. When the person closes, unfortunately, the disc does not stay, and you can see the disc popping back out of place again. Actually, during closing, people don't usually hear it as a pop because it's more of a slipping maneuver, but on opening, the pop is usually more apparent. With enough of that going on, eventually the back edge of the disc becomes thin and doesn't hold itself in place very well.
Okay. If people ignore this clicking, you know, to what degree will, or severity, will this get worse over time, or will they even lose the actual bone on bone?
They can, and the next stage in the process is typically, again going to the skull here, when the disc goes out of place, but the ligaments that control it have become so stretched and the disc has become so thin that even when someone opens wide, they're not able to pop the disc into place. At that point, people typically have some limited opening, but if they ignore the problem, put up with the pain, take their analgesics and anti-inflammatories and so on long enough, they eventually stretch the ligaments so that they can open almost normally. However, when the disc is that far thinned, it's very difficult to get it to go back into place again, and typically the process continues. We can show that in the third video clip from Dr. Per Westerson again. If we look at this one, where you can see the disc is ahead of the condyle, and as the person opens, the condyle moves farther and farther, but the disc never does go into place between the bones. And when the person closes, that condyle simply rests back in that tender tissue again. So again, if people really work at it, they can extend their opening until they have an almost normal opening. What may fool some people too is at this point, since the disc is not going back into place again, it's not clicking very much. It doesn't make a lot of noise. So some people think, well, I'm getting better. I just have to wait it out. I don't click anymore and I'm healing. And actually the exact opposite may be what's happening.
Wow, that's amazing. And so they need to come in and have this resolved, because even though the noise goes away, the actual event of the TMD does not.
Exactly. And then the pain typically goes from being sporadic to low-grade chronic pain. And people continue to have low-grade pain. They wake up with it in the morning, they deal with it during the day, and they suffer with it through whatever they do. Some people think that's a normal part of aging, is that we begin to have, some chronic pain, maybe some chronic headache or neck pain, that it's normal for older people to want a soft diet because it's difficult to chew soft, or difficult to chew harder foods, I should say. And if the process is prolonged, it can even start interfering with sleep. Chronic pain does interfere with sleep quality, and then people are exhausted all the time. So essentially, a temporomandibular disorder aggravates all of the effects of aging and may make people age essentially prematurely as far as all those symptoms go. And long range, let's go to our last video clip here too. And this one shows the disc almost completely gone. You can see only a little ball of disc tissue in front of the condyle. Notice on this one it's moving the opposite way from the others. But as the condyle moves, it simply pushes on that little bit of disc. Notice also that that bony condyle is not round anymore. It's flat, and it even has a sharp edge on the front. This is a severely degenerated joint. And what happens in this circumstance, as the condyle degenerates, the jaw moves upward and back. It essentially rocks over the back teeth. The front teeth don't come together very well anymore. People feel like they don't really have a bite or know where to put their teeth. And then generally they have pretty much ongoing chronic facial pain, headache, and difficulty eating.
So you were mentioning, you know, people that are getting older and they're starting to eat a soft diet, and that's, as you said, as we do get older, our shoulders wear out, our knees wear out, and there are replacements for those now, and hip replacements and such. So instead of an older person thinking to go to a soft diet, they may consider the fact that they might have TMD.
Yes, they certainly could.
And this would benefit them so much more to actually come to you and maybe even alleviate that problem so they don't have to take all the drugs that they're on, along with their quality of life.
Well, it's always better to treat the cause rather than simply the symptoms of a disorder.
Exactly, yes.
So that leads us into how to determine if you actually have such a disorder. And there are some fairly simple things that you can do if you want to at least do a basic screening examination for TMD. So, as I said...
Yeah, we had a little test that we were going to give our little viewers so that they can test themselves to see if they have it. Yeah, that'd be great. Okay.
And some very simple things to test yourself and see if you have the signs or symptoms or likelihood of a TMD problem. First, put your fingers right over your jaw joints. They're right in front of the ears. You can feel that bone move as you open and close. Push all around that joint, behind it, up and behind it, on top of it, right over the bony knob, and determine if it's tender. Tenderness means you have arthralgia, or pain coming from the joint, and generally it means there's inflammation inside the joint. Second, with your fingers lightly over the joint, open your mouth wide and close again, and you should feel smooth, quiet movement of the bone. If you feel irregularity, or if one side moves before the other, then you probably have something going on inside the joint. It could also be a muscle spasm problem, so the next step is to test the muscles. So if you go to the masseter muscles, again, they're the muscles you can feel in the cheeks if you clench your teeth. And they bulge out at that point. But feel them right where they attach to the cheekbone up here, then halfway down, and again where they reach the jaw. If any of those areas are tender, you probably have some muscle involvement going on. And then it's up to someone to determine, preferably a practitioner in the field, to determine if your problem is only muscular, if it's only joint related, or both. The next muscle to check is the temporalis muscle up on the sides of the head. So simply put your fingers in your temples and push hard. That's not bone right there. That's muscle. In fact, there's a good thick band of muscle in that area. And if that's tender, either right toward the front or a little farther back, again, there's a good sign that you have a disorder. And finally, simply look into a mirror and get up close, show your teeth, and open and close as wide as you can. As you look, you should see the mouth open and close along a straight line. If instead your jaw is doing a zigzag, or if it deflects off to one side or the other side as you open and close, there's some kind of a restriction going on, and you need further evaluation.
Okay, so the viewers can do that at home. That was great advice for them, and they can find out exactly if you know, those are concerns that they have. Yeah. Now, my next question, then, I want to say that, oh, someone is probably had this for quite some time, severity of it. Is there anything on your professional level that you can do for someone that has had it for quite a long time?
Oh, certainly. And of course, one choice is to ignore it, and as we've been discussing, I think that's a poor choice, so please don't do that. When people hear they have a problem with the joint, they immediately wonder, do I need surgery? And actually, surgery on the TMJ is not done very frequently. Several reasons for that. The failure rate is reasonably high, and even in those people for whom surgery works, frequently the problem comes back months or years later.